Let's get into it first. Before we even start discussing the numbers and everything, what is your definition of an abortion? What is your definition of an abortion? Talk about this report then when we talk about lots of women who now go into an abortion. And we do know, of course, by this time it is not necessarily a case of emergency, else they'd be in hospital. If, an expectant mother starts to bleed, the first place she'll go to is the hospital, and then it'll be determined it's an emergency. But with the cases that we're seeing now, it is by choice. It is either unwanted, unplanned, or mistimed. Those are some of the cliche terms that we hear being used. What are your thoughts on the numbers? Could they be higher?
When a woman has unwanted pregnancy and they really want to abort it, they don't think of the hospital first. They talk to their friends, they talk to their relatives, and most of the time they are directed to a private, unsafe provider of abortion. Sometimes they even buy medicine or take things that they think will terminate the pregnancy, and they do it on themselves. We know a number of women take Omo, they take Jik, they take concentrated tea. We have had cases of people taking quinine, high doses of quinine or Panadol, and then they come to hospital very sick. Some even use, sticks, spoons, forks to poke themselves, and then when they start bleeding, they come to hospital. So this study was just counting those women. The women who had tried to do something with themselves or had gone to someone who did not know what to do, and then they interfered with the pregnancy, and then the woman comes to hospital.
What is your definition of an abortion?
Abortion conventionally and medically is defined as the termination of a pregnancy before it is viable to exist outside of the body. That can be spontaneous, meaning that it came out by itself, or it can be induced. So someone interfered or made it to come out before viability, meaning once it comes out, it cannot survive. Things that they think will terminate the pregnancy, and they do it on themselves. We know a number of women take Omo, they take Jik, they take concentrated tea. For me, when one unsafe abortion happens, when one woman dies from unsafe abortion, it is a clear signal of system failure.
passed a constitution which provides under Article 26(4) that a woman who is pregnant may access safe termination of pregnancy if, in the opinion of a trained health professional, her life is in danger or her health is in danger or in case of an emergency.
We are not seeking for legalization of abortion on demand. That is not the issue. We are just seeking that for those who are faced with health risks, emergencies, or where otherwise the law provides, be provided that opportunity.